So there are points of encounter uh, of the patient with the specialist or the physician. So each point of encounter is a time to understand and study the patient further. So you may encounter the patient in your OPD, in your OP practice, outpatient practice. So here, maybe in India we have a shortage of time. See, we do not get time more than 10 to 15 minutes maximum. That I'm saying is, if you're lucky, you get that much time. 10 to 15 minutes is good time. But the average time should be for a geriatric patient at least 20 minutes, because you need to assess so many things. You need to speak to the patient. You need to go through a lot of documentation, so and you have to do a lot of advising also. So that takes time. It takes time. And in many hospitals, the problems happen because of the turnover issues, because they want us to see many patients within a short span. It's not possible as far as a geriatric patient is concerned. So that is one sort of encounter is in the outpatient department, which is your primary point of contact with the patient. The other point of contact with the patient is in the emergency or in the casualty, where the patient is brought in with some acute problems. So there you need to assess the patient once again to see if he's he's a pre-registered patient or somebody you have been seeing him. You may know the history and his clinical details. Otherwise, at that point, you need to assess him. So, that also is a difficult assessment, because many times the patients may not be that communicative, maybe in delirium, maybe comatose, so it is up to you to pick up the details. The third point of contact will be in a hospital setting, I'm saying, is in the inpatient ward. So the patient may have been come in for a different problem. They may have come in for the heart attack or a stroke, or any other department, any other problem. They may be admitted and they develop issues. So at that point of time, the role of an internist or a geriatrician is important. So they will be able to guide regarding all other management, whether it is just take the simple help of a geriatrician or a physician, where there is uncontrolled diabetes, or there is a bed sore, or there is incontinence, So things like that, we definitely can help out in assessing and helping the other departments. So even if a patient is admitted in another department, they can always ask for help from the internal medicine physician or the geriatrician and help sort out the matter.